You're listening to Dental MD. I'm Dr. Jessica Sapoff. Today, I'm going to talk about the dentistry that you need today and what is causing the breakdown that you are having in your oral health and your teeth. Now, some of the things that you need done now are a result of things that were done when you were younger or weren't done when you were younger. So things that might have gotten missed that, in your younger years, and now they are showing up because of wear and tear, because of things that weren't done to correct and prevent. And then the other category is, work that was done that has led to further procedures now. So as an adult, you go into the dental office and you have, a list is made for you of all the things that need to be done, which everybody dreads. I mean, part of fear of going to the dentist is the list and, whether it's covered or not covered and all that kind of stuff. There are a lot of reasons for trauma. Some of them are financial, and some of them are fear of the sound of drilling or just the whole idea of a needle, etc. So the things that dentistry in the mainstream, what they do and what they don't do routinely, can over time lead to very specific kinds of problems. I'll just give you a quick for instance, and then I'll go into some history and background. So a quick example would be orthodontics that was done by removing 4 teeth and then retracting and contracting the arches. Now, some of the, it may look nice from the front, and that is usually the top goal, is how do the teeth look from the front. But they're not looking at your profile, they're not looking at your lip support, and they're not looking at your jaw alignment or your muscle balance. All of those things that aren't, or tongue space, that's a huge one, because apnea and airway resistance and snoring are really epidemic at this point, I would say. And inadequate tongue space, I know the mainstream does not agree with this. Maybe some people that are mainstream think this idea has merit, but the official stance of mainstream self-proclaimed setters of standards of care don't agree that insufficient tongue space could possibly cause your tongue to sit further back toward your throat than would be ideal for your airway. Now, that is, all of those things that get overlooked, missed, or not looked for during the first orthodontic treatment that you have, though even if they didn't take out teeth, they still may have missed the jaw alignment and muscle balance issue, neck posture issue, and kind of moved your teeth to where you're sort of locked into a particular posture with all of those structures. And that, in some people, can lead to problems 10, 20, and 30 years later. Specific kinds of problems, like damage to the teeth from clenching, or damage to the teeth from just normal chewing wear and tear that should have been normal but is actually excessive because tooth position is not aligned with how your muscles function best during chewing, and the teeth aren't in a harmonious position. So there are a lot of reasons why people break cusps off of teeth. One of them is the kind of fillings that were put in the teeth, like the big mercury fillings, which expand and contract at a different rate than normal tooth structure, so they create little microfractures down below. And then you bite on something chewy, not even necessarily a foreign object in your food, although that'll almost always cause a problem if you hit it hard enough. But, there are weak areas of some of your teeth as a result of the kind of fillings that were done. And then you add to that the position of the teeth and the pattern of chewing that may not be, or that the teeth are worn down, and so parts of the teeth that were never meant to be in complete function during chewing are now touching and part of the grinding process. And that part of your tooth is only in contact because the other parts have been worn down through clenching, grinding, or whatever other things have happened. Maybe a dentist got in there and adjusted your bite, and now everything is a little lower, and which can be a good thing, or it can be something that throws off muscle balance and joint alignment. And you may not see the signs of that wear and tear or feel any symptoms of that wear and tear for many, many years following that event. So one of the things that I do as a holistic practitioner is I try to look at the big picture and tie all of these events together to understand what's happening in the present. Now, all of that takes time and diagnostic skill and knowledge. A lot of education goes into being able to understand all of the pieces of the puzzle. And, that takes time, and it takes time in the office as well to look at all of those things and understand what's happening and what the trajectory is. The easy way out is to look in, see a tooth that's cracked, say what's needed to fix the cracked tooth, end of analysis. That's easy, that's quick, time is money. Then you get the person, you do it right on the spot, or you get them right back in to do that crown or onlay or whatever you're going to do. And that's the quick, easy dentistry is just basically a repair person. You look in the mouth, see what's broken, propose what you're going to do to fix everything, make a list, and then the person comes back and you check off items on the list as you fix them. And then the person's good to go. But, people who are more holistically minded tend to want to understand the problem so as to prevent its recurrence or its, happening again on another tooth, that kind of thing. And some of the things that are from the past can be corrected to prevent cracks, wear, breakdown, pain, infection, etc. But if you don't look at the bigger picture and understand how all the pieces fit together, you may not know, it may not occur to you as a dentist to know what to do to prevent. Now, that prevention, those prevention processes that can be done, because there are no symptoms yet or breakdown yet, a lot of times people will nod and say, yes, that makes sense, but I have car payments and other things I have to deal with, and so I am not going to do that yet. And that's fine. But just knowing what could be down the road and kind of having it on your back burner so that you understand how you could, perhaps there's something that can be done that could prevent future breakdown by correcting something that was either done in a way that didn't prevent or that was missed or overlooked. And, a lot of times people who are preventive and holistic minded will want to do procedures and processes that, because it doesn't always include drilling on teeth to do these preventions. Sometimes it's just going in and aligning the joints of the jaw to prevent future problems in the jaw joints, that kind of thing. And the only time that we say that you need to do that is if you actually have pain in your jaw joint or associated structures. But even then, the mainstream does not agree with treating this because they this is kind of an interesting thing, but for all of the things that are preventive that most dentists don't know about, the mainstream has alternative ways to manage these things so that dentists don't actually have to go and learn how to align joints or balance muscles or any of that stuff. And unfortunately, it includes things like tranquilizers and antidepressants and psychological profile and therapy, because the assumption is that your jaw hurts because you're under stress. And they consider it a self-limiting condition because it's usually women, and it's usually during a certain part of life, like middle age, 30s, 40s, 50s. And by the time you're late 50s or 60s, the condition is no longer painful. You may not be able to open very wide, and you may have popping and clicking, but you're no longer in pain. And so they consider it to be a self-limiting, self-correcting condition. But, you know, that I don't think that makes, the best sense for some people who would want to correct these things and not just allow arthritic degeneration of the joint to the point where, it's all changed shapes in there and no longer causing actual noticeable pain. So it's up to the patient if they want to do preventive things or if they want to just wait it out or try other strategies like lots of pain meds at night or in the morning or whatever, antidepressants and counseling for your stress. That the idea that stress is the main cause of clenching and grinding is still the mainstream concept, but I think that has been kind of, there are other ideas that for me make more sense for a lot of cases. I'm not saying that's never the case, but that's not always the case. All right. You are listening to Dental MD. I am Dr. Jessica Sapoff, and if you have questions about any of the things that I'm talking about today, or you want to come in for an exam, treatment, second opinion, anything, give us a call, 425-427-8899, and you can also reach the front desk, appointments@naturaldentist.com. You are listening to Dental MD. I'll be right back after this break.
So how long has it been since you've been to the dentist? Yeah, I'm talking to you. I know going to the dentist can be tough, but did you know that healthy teeth lead to a healthy body? I know what you're thinking. All dentists are alike. They lure you in for the free exam or, complimentary cleaning. And before you know it, wham! Huge dental bill. And did you even need all that work? Well, why not try a different approach? Natural Dental Health Associates in Issaquah specializes in taking care of you. Their easy, no gimmick, honest approach to dentistry will have you forgetting you're actually in a dentist's office. And the best thing is, they're all natural. Yep, no mercury, nickel, or other harmful chemicals are used. Click on your media player now and get started on the road to better dental health today. Or call 425-427-8899. Natural Dental Health Associates is a proud sponsor of the Dental MD radio show, Wednesdays at 9 a.m. on Alternative Talk, 1150 a.m.
Honey, isn't it amazing?
What?
The sacrifice, the dedication, the grit. I mean, they really set an example, don't they?
Oh, well, no question. Today's high school athletes are truly special.
Not the athletes.
Well, who?
The officials.
Oh.
Today's student athletes are truly special. But there's something pretty great about the men and women who officiate their games, too. Like the way they're giving back to their communities. Officiating is a terrific way to stay in shape, meet new people, and stay connected to the game you love. But the biggest reason of all? We need more qualified high school officials here in Washington. And without them, the rest of us would have a whole lot less to cheer about. High school games need officials. High school sports need you.
Great call, Ralph!
Yeah!
Interested in becoming a licensed high school official? Go to highschoolofficials.com to learn more and begin the application process.
Multicultural, multidimensional even. Alternative Talk 1150.
Welcome back. You're listening to Dental MD. I'm Dr. Jessica Sapoff. And today I'm talking about tooth breakdown and some of the causes and the way that I approach looking at tooth breakdown to see whether there are underlying conditions that would lead to other teeth having the same issues rather than just fixing the tooth with the problem and then sending you out the door. It makes sense to me to look at and not just the immediate cause. Sure, you have a big filling and the tooth was weak and so that part broke away and now you need an onlay or a crown. Well, but that's the immediate cause, or the immediate cause was that popcorn you ate. Well, don't eat popcorn or give somebody that you don't like the bottom third of the bag. It's a common joke in dentistry. But anyway, because of course, the hard kernels that fall to the bottom can break your teeth. But it's not the kernel. I mean, the kernel did in the immediate moment break your tooth, yes. But why was your tooth breakable? And not just the fact that there's a big metal filling in the tooth that undermined the cusps, left them weak, and then expanded and contracted and caused little microfractures underneath these little weak spots, and then boom, they just break away. Was it the popcorn kernel? Was it the filling? Or is it because you clench and grind your teeth and caused little cracks to get worse and worse and worse in the teeth, like even worse than they would have been as microfractures because of large metal fillings that expand and contract at a different rate than your tooth structure, causing little cracks and weaknesses. But even further, looking back even further, clenching and grinding that makes all of this worse. Why are you clenching and grinding? Well, is that should we just shrug and say, well, just some people clench and grind and it's just how it is? Or you're under stress, maybe you should, see a counselor, or maybe let's just stick this piece of plastic between your teeth so that you can go ahead and clench since it's what you're going to do anyway, but this way you won't make your teeth worse. But what is behind the clenching? There's even more to this story, and part of it has to do with jaw alignment and muscle posture, and especially airway, because airway issues are becoming an epidemic. Apnea, airway resistance syndrome, snoring, tonsils, allergies, edema, puffiness in general of the tissues, and then add to that tongue position that's a little bit too far back, causing a little constriction, elongated soft palate because of years of snoring. There's just so much to this, but why, okay, so when you're having an airway problem, which is so common, as I just said, and you're sleeping, your body is going to prioritize things, and it's going to say airway is the most important thing. Breathing when you're sleeping is going to take precedence over everything else. So in order to get your airway open, your body will automatically do a number of things. One of them is your jaw will move forward. Now, there are different theories as to what the mechanism is. How does your body get your jaw to move forward when you're asleep? But we'll just leave that aside for the moment, and we'll say there's an emergency mechanism that brings your jaw forward. That opens the airway because it pulls your tongue forward along with it. However, then your jaw is forward. You can try this now. Move your chin forward a little bit and then touch your teeth gently together. Which teeth hit? It's going to be your front teeth. Where is most of the wear that you have on your teeth? The front teeth. In a lot of people, the front teeth are very thin and worn and chipping. That is a problem. It becomes an aesthetic problem, becomes a problem that shows when you smile. But sometimes people just clamp down and slam on their back teeth too in the process of moving the jaw to try to open that airway. If you slam, when your body is having an airway issue, to your system, your emergency system in your body, that's an emergency. So it activates the emergency system to open your airway, and that includes some adrenaline. Now, when you have adrenaline going, this is going to do a number of things. One is that if you do move your jaw and touch your teeth together, you're going to hit them hard. And it's a panic kind of situation, and the pounds per square inch that you just applied to your teeth is much, much greater than you could ever do when awake. You could never reproduce that level of slamming of the teeth when you're awake. And you wouldn't, but you also couldn't. Now, the other thing that happens is your heart rate goes up, your blood pressure goes up. I mean, everything involved with a spike in your adrenaline that you can imagine, including your insulin resistance and all your other endocrine functions go into this emergency mode along with everything else, because the adrenals are part of your endocrine system, and your entire body says, all right, we're in this mode, and we don't care. Your emergency stay alive system of your body doesn't care what damage is done during the emergency, as long as it gets your airway open. If it gets you to turn over, if it gets you to wake up, whatever it does, and it's going to do this. And your teeth are not the most important thing to your body in that moment. Your airway is. And so everything else just gets, this extreme action. And there's a lot of damage that takes place. But the airway is the most important thing. And so your body disregards the rest of it. And having your blood pressure spike during this is not a once a night thing. This is a several times an hour thing. And in adults, if this happens less than 15 times an hour, you're considered mild. And this is a lot of times to have your blood pressure spike, especially if you have high blood pressure already or any other kind of coronary artery disease or heart disease. And there are lots of other ailments that can be made worse by this as well. Pretty near everything, actually. So airway is very important. So I recommend that people deal with the airway. And I know it doesn't seem natural to have to wear an appliance or wear a CPAP, but we really don't understand yet what all of the causes are for sleep apnea. And until we do, and until we can find a natural way for the body to heal from this and not have the problem, hopefully, although the mainstream, I must add, feels that once you have been diagnosed with sleep apnea, that is a lifelong condition and you will never, ever, for the rest of your life, be able to sleep without some kind of assistance device, such as a CPAP or an oral appliance. I don't like to, believe that our bodies can't heal things. I really do believe in healing, but for purposes of this conversation, the mainstream medical establishment has declared that sleep apnea is a chronic lifelong condition that cannot be cured. It's incurable according to mainstream. So we'll just leave it at that for now, because any other statements about it are considered quackery, basically. Unfortunately, that's the implication, is that if anybody says otherwise from what the mainstream medical establishment states, that is considered fraud and quackery. So for purposes of these discussions, but I'm not going to rule out discussions about healing and getting better, but I will say that if you have these issues, you should be having it treated, because this is a body emergency. And if you have sleep apnea, don't delay getting the devices necessary to make sure your airway stays open at night because of all the other physical problems that will happen or get worse if you already have them if you don't treat it. So, setting aside the conversation about whether you're going to be using a CPAP forever or not is secondary. If you have apnea now, do get it treated with either a CPAP or an oral appliance made by a dentist to prop your airway open so that you breathe all night. And in children, this is an even bigger emergency because when their oxygen levels are fluctuating, it is affecting their growth. And when their sleep cycles are disturbed by this breathing emergency, even if they don't wake all the way up, they're not getting their growth time and their dream time. All of us, anybody with any kind of apnea or airway issue, your stage 3, your N3 stage of sleep and your REM sleep are being continually interrupted, and you can't repair your body or grow well or, have the nice, calm and smooth psychology that is possible when we have enough time for dreaming in our sleep. So having that be continually interrupted is basically fragmented sleep, which leads to many other problems. So do get that treated. Now, the things that can cause airway problems, as we were starting to say before, and this is related to clenching and grinding as well, that is definitely kind of the final straw for some people's teeth when they develop apnea and start doing some massive clenching, grinding. You'll see some really rapid wear of the teeth, breakage, movement of the teeth, spaces opening up between teeth, food catching that didn't used to, that kind of stuff. And it's really hard on the surrounding structures. Gum disease, bone loss, these kinds of things are, if this isn't treated, you can end up with, and if you end up with bone loss and teeth shifting and moving and loose, and on top of everything else, you could be told that you have gum disease, which you technically do because although those are all signs of gum disease, but you could be making this a lot worse by clenching and grinding in your sleep massively. All right, so I'm going to head into a break here in a moment. If you have questions about any of the topics that I'm talking about today, please give us a call, 425-427-8899 in Issaquah, Natural Dental Health Associates. And you can reach the front desk by email, appointments@naturaldentist.com. I'm Dr. Jessica Sapoff, and you're listening to Dental MD. I'll be right back.
I'm Dr. Anthony Lazowitz, and this is Climate Connections. Each winter, logging trucks rumble in and out of Wisconsin forests, harvesting trees that will be converted into paper, furniture, and other wood products.
Winter has traditionally been the core time for timber harvesting.
Adina Rissman of the University of Wisconsin in Madison studies the logging industry. She says hard frozen ground makes it easier to move equipment in and out of forests without getting stuck in the mud or damaging soil and roads. But winters in Wisconsin are warming.
We can clearly demonstrate over the last 50 years a 2 to 3 week shortening of the frozen ground season. And that's just on average. I mean, some years have very little to no frozen ground. If your winter is mud instead of ice, then it's difficult or impossible to get the job done.
Rissman says that to adapt, loggers can invest in equipment better suited for wet conditions or compete for high-demand jobs in drier areas. But these changes cost money, and Rissman says the added expense can be a strain for loggers working in an industry that's already stressed by global competition and a changing market. Climate Connections is produced by the Yale Center for Environmental Communication. Learn more at yaleclimateconnections.org.
Alternative Talk 1150. We're on your radio at 1150 a.m. We're on your HD radio at 98.9 Channel 3.
So many ways to listen.
We're on the web at 1150kknw.com, streaming live audio and video as well as MP3 archives of many of our shows.
So many ways to listen.
And now, we're on your smartphone or tablet. Download our free app in the Apple App Store or Google Play and take Alternative Talk 1150 anywhere you go.
So many ways to listen.
Need help getting started with self-help? You came to the right place. Alternative Talk 1150.
Welcome back. You're listening to Dental MD. I'm Dr. Jessica Sapoff. And today I'm talking about the causes of tooth breakdown in terms of what was or was not done for you, for your teeth in the past. And now orthodontics that's done or that's missed, and we were talking about jaw alignment and muscle balance. A lot of times orthodontic treatment is done for aesthetics, to make the front teeth, so they're not crowded anymore, so everything is straight, correct cross bites, all that kind of stuff. And the joint alignment, because children usually don't have symptoms of jaw joint problems, TMJ issues, it just sort of gets overlooked. If there's no pain or problem there, then that is sort of ignored and not considered prior to moving teeth. So expansion of the arches is sometimes done, but how that's done can make a difference to the end result and final result of the orthodontics. And, a lot of people have relapse of their orthodontic treatment. They have crowding that recurs because teeth remember where they were. But it's not just that the ligaments have a memory of where the tooth used to be. There are other factors, like if the muscle balance is not taken into consideration, then how the muscles are working will be a force factor that affects the positions of the teeth. The teeth want to move into what's called the neutral zone between where the tongue is and the cheek muscles and lip muscles, and they will if they're not in the neutral zone, then they're going to be feeling pressure either from the inside or the outside on them. And when there's pressure on the teeth that is not equal on both sides, the tooth will move. That's actually how we move teeth. We deliberately put pressure on one side of the tooth and very gently, and the tooth accommodates. It shifts in the socket that it's sitting in, and then the ligaments and bone adjust themselves around the new position, and then you apply pressure again and shift the tooth inside of its existing socket so that it's got some pressure on the root on one side, and then the ligaments and bone rearrange themselves to alleviate that pressure, and gradually the tooth moves through the bone, literally. And when that is all finished and the teeth are where they look nice, is that if that position of the teeth is not in harmony with the pressures from the lips, cheeks, and tongue, then the teeth will move again, and that's why everybody has to wear retainers to try to prevent that. So these things that have to be done for you as an adult, such as fixing orthodontic relapse, which, a lot of times when the front teeth are crowded and not in their exact position, and you add clenching and grinding to that, you end up wearing the teeth down in kind of funny patterns sometimes. Sometimes they'll wear down at an angle, and then when the tooth is straightened, it's got a slant on the top of the tooth because of the way it got worn over the years. And so then those things have to be corrected to make the tops of the teeth all look level and natural again. And, the the forces on the teeth are, it's sometimes hard to measure what those are, hard to predict what those are going to be. But if the lower jaw is allowed to position itself, and there are ways to put it approximately in a correct, physiologically correct class 1 bite position, and then the teeth may not chew well in that position yet until you do the orthodontic treatment and move the teeth. But if you allow the jaw to balance and center itself, more times than not, it will go directly into a class 1 position with midlines that line up and a good overjet and overbite position rather than a deep bite. And in that position where the muscles are relaxed and balanced, if you look, the jaw joint is frequently also physiologically aligned. Now, there's no way to get this exact, but my philosophy is to allow the body to find center. And that is easier if the neck posture and other factors are also, everything is aligned. Because if the neck is off, if there's been an injury or, whatever causes of spinal and neck posture being out of position, that will affect how the jaw, when the jaw goes to what it thinks is kind of a neutral position, it may not be as centered as it would be if you were to see a skilled chiropractor and have spinal alignments done. Then you're more likely to get a nice centered jaw position as well. And for people with jaw symptoms, this is a critical step. But for people who are just coming in and want their teeth straight, it's just a step that helps prevent relapse later, because this is one of the ways that we can allow the body to show us what a balanced position is, so that we can move teeth into what's more likely to be the most neutral position, where they won't be receiving stress from one side or the other that would be enough to cause a recurrence of the misalignment. Okay, I know that was long. I hope that made sense. But if, when you're a child, the orthodontics is not done this way, instead of allowing for natural alignment to occur and then moving the teeth to support that position, if the teeth are simply moved to where they look nice and all the rest of the surrounding structures are sort of ignored, then there are people who say that leads to a more likely relapse scenario, where you would have to get your teeth realigned, or might want to get your teeth realigned later as an adult. And along came clear aligners, such as Invisalign, that are extremely good at realigning minor relapse cases. When we do that, we're still not aligning the joints. We're just putting the teeth back to where they look nice, and then you have to wear your retainers or it'll probably go back to that misalignment. For some people, they've had their ortho as a kid, they've got relapse, but they also have popping and clicking and pain in the jaw joint. Now, orthodontics does not cause the jaw joint to have these problems, but I believe that if the joint alignment is not addressed at an early age, then that misalignment may persist into adulthood, and it's really just a missed opportunity. When the ortho is done initially, if the joints are aligned, then it may be less likely that people would have clicking, popping, and pain along with their relapse later. And I see a lot of cases like this, and if there's popping, clicking, and pain, then the first thing I do is see if I can get muscle balance and alignment using a splint to support that position, so the person can chew and eat and function with their jaw in this balanced position, and see if the symptoms are relieved. Now, if that person does not want to do ortho again, they don't mind their teeth being crowded, that's fine. Sometimes once we get them out of that jaw joint pain and alleviate the clicking, hopefully, not always, but if we can, then we do. But the main thing is to get people out of pain. And some people can take that splint and then use that as a night guard to protect the teeth at night and kind of help maintain and support that position that is more comfortable for the joints. And then during the day, their teeth don't quite match when they're relaxed, but they can still chew food and they're not uncomfortable. Then you don't need to redo the ortho, or wear a splint during the day. But some people need to continue to wear their splint during the day because they're more comfortable, or they may want to go ahead and redo some of the orthodontic positioning of the teeth to support the position of the jaw that doesn't pop, click, or hurt. And so ortho, in that case, is just to bring the teeth into a position that supports the aligned jaw. And this is a process. This takes a while to do. It's, and it's not cheap. So, but for some people it's necessary, and it can prevent wear and tear and breakage and clenching and other problems that arise from the jaw being misaligned, the muscles being out of balance. All right. You're listening to Dental MD. If you have questions about the topics today that I'm talking about, give us a call, 425-427-8899 in Issaquah. And you can also reach the front desk, appointments at naturaldentist.com. You are listening to Dental MD. I'm Dr. Jessica Sapoff, and I'll be right back.
In Africa, 5-year-old Chiru has no choice. She and millions like her must walk miles every day for dirty water. But together, we can end their walk by providing clean water close by. Instead of spending hours walking to get water that makes them sick, girls can be in a classroom that expands their minds, and moms will gain back time to care for their families. Sons and daughters can grow up strong, finally free of sicknesses caused by dirty water. At World Vision, care about clean water runs deep. Deep enough to reach one new person with clean water every 10 seconds. Because every child, every person, everywhere deserves clean water and the chance to rise to their full potential. It's true. When you just add water, you change a life. Learn more at worldvision.org.
So how long has it been since you've been to the dentist? Yeah, I'm talking to you. I know going to the dentist can be tough, but did you know that healthy teeth lead to a healthy body? I know what you're thinking. All dentists are alike. They lure you in for the free exam or, complimentary cleaning. And before you know it, wham! Huge dental bill. And did you even need all that work? Well, why not try a different approach? Natural Dental Health Associates in Issaquah specializes in taking care of you. Their easy, no gimmick, honest approach to dentistry will have you forgetting you're actually in a dentist's office. And the best thing is, they're all natural. Yep, no mercury, nickel, or other harmful chemicals are used. Click on your media player now and get started on the road to better dental health today. Or call 425-427-8899. Natural Dental Health Associates is a proud sponsor of the Dental MD radio show, Wednesdays at 9 a.m. on Alternative Talk, 1150 a.m.
Exploring new territory every day. This is Alternative Talk, 1150.
Welcome back. You're listening to Dental MD. I'm Dr. Jessica Sapoff. Today I'm talking about tooth breakdown and looking at the bigger picture of what the causes, things that may be causal to today's breakdown for you and your teeth, and how we might treat or retreat orthodontics, or just, a properly designed guard, if that's what's necessary, or sleep apnea treatment in order to make sure your airway doesn't close on you while you're sleeping and create a really, an emergency situation in your body to try to open up that airway. And you don't even have to have full out apnea. You can have something called airway resistance syndrome, which doesn't even always have snoring involved, but frequently it does. The narrowed airway is sort of like breathing through a cocktail straw instead of a, bubble tea straw. And it does create a little bit of a, drop in your oxygen, enough to set off this whole alarm system in your body, which is extremely traumatic for all the other tissues of your body, including your teeth and muscles and everything. So, and it creates a big cascade of endocrine problems, which can lead to weight gain. And so it's kind of a chicken and egg thing. The weight gain is definitely associated with apnea, although there are lots of thin people with apnea and airway resistance. Believe me, a lot of them. And a lot of those people aren't screened. They're not, because they're thin, so they're not thought of as being someone that could have apnea, but frequently they do. And this, it's kind of a chicken and egg thing, because weight gain is associated with apnea, but apnea can also contribute to weight gain by throwing off your entire endocrine system, including your insulin resistance and other hormones associated with appetite, etc. So getting that checked and treated is very important for your overall health and for your dental health. But I want to get back to talking about what we do in my office for children when I see the beginnings of some of these problems. Do I wait until it's a problem, or do I go ahead and offer a treatment that may help prevent some of these issues? We don't know for sure, because if we prevent these things and that individual never develops certain problems, we don't actually know whether what we did prevented it, or whether that person was just never going to have an airway issue or orthodontic relapse. There's just no way to know unless you do a huge kind of epidemiological survey and look at what treatments were done and not done, and then look at what the results are as adults. But it would have to be a very large number of people to get any kind of conclusions that made sense. But on a theoretical, hypothetical basis, we look at children's teeth and muscle balance and joint alignment, and we can see if things are out of position, because the bite will be deep, or there will be an open bite, or there will be something called tongue splinting, it's called, where in order to swallow properly, the tongue goes into a position. It's called a tongue thrust sometimes, and it can be sideways toward the back teeth to support the opening between the upper and lower jaw during swallowing, and it can also force the tongue forward. And that pressure on the teeth can cause tooth movement, and so sometimes dentists, I don't know if they still do this, but I guess maybe, they put in a little appliance on kids that has little pointy things on it to try to train the tongue to stay back where it belongs. That makes a whole lot of sense, right? Not. So what I do in cases of, tongue splinting, we call it, where the tongue is put between the upper and lower arch to stabilize the lower jaw for swallowing, that is a sign that the swallow muscles function best when the jaw is in the position that the tongue is supporting it in, and that's probably also the best position for airway. It's, that's probably the physiologically or close to the physiologically correct position for that lower jaw. So what I will do in a child, it's actually quite a bit simpler in children to correct these things because they're still growing. And so besides expanding the arches to make them wide enough to accommodate, large enough and round enough to accommodate the new teeth that are going to be coming in, besides expansion, we can also put appliances in that allow chewing in that class 1 correct vertical midline aligned position, and we just have them chewing in that position on appliances while the 6-year molar and 12-year molar erupt into place. And those, we don't have to move those big molars in the back because they're growing in right now. And so all we have to do is allow them to come in all the way in to the right position. And when the bottom molars meet the top molars and grow all the way in so that they chew in the back, then we don't need the positioning appliance anymore because the back teeth have come in and stabilized the bite in a corrected midline, corrected vertical, class 1 occlusion. And so, and that position is the position that the jaw, by allowing the jaw to center itself, we can sort of capture that in a bite registration and make the appliances coordinate with that so that that's the position that the child is chewing, eating, breathing, functioning in while the teeth are growing in. And once the back teeth have stabilized things, and we just need to allow that process to happen naturally in a child. Sometimes it's like watching paint dry or grass grow. It can take a while, and you check them every month and make sure everything's, the appliance is still in good condition and still supporting the right position. And if there is any airway issue suspected, that has to be dealt with separately. We can't just assume that by positioning the jaw and allowing the tongue to resume normal function and allowing the teeth to grow in to support and stabilize that corrected position, that's always going to cure the airway problem. And the airway problem in kids is such an urgent thing because it affects growth and development, and it affects their psychological status. A lot of cases of ADHD or hyperactivity are just misdiagnosed sleep apnea. Some of these kids just aren't sleeping well, and we don't know because they're not waking up all the way and letting us know that they aren't sleeping well, but they're just having their sleep interrupted over and over and over all night with the airway problems, and that will affect children's behavior. They don't act sleepy like adults. They act out and try to compensate for it, and they get punchy and giddy and hyperactive. And in some children that behave that way, it is an airway and sleep problem. So do not hesitate to get your children checked and treated for that. That can be done concurrently at the same time as our orthodontic and orthopedic positioning treatments that we are doing to make sure that that chewing and biting position is as close to the neutral zone, where the teeth are in the neutral zone, as possible for preventing future relapse. If we can get the teeth to grow into the right place the first time by creating space and allowing for it using specially designed orthodontic appliances, we can prevent a lot of malpositioning later and relapse later. It's a lot less likely if those teeth are allowed to come into the right places in the first place. So that's one of the ways that we prevent a lot of the breakdown later. And if there's still some clenching or habits, sure, a night guard or something like that for those cases. But I think it's going to be a lot less likely with a lot less breakdown. And then I don't have time to talk about fillings, but doing fillings in a way that doesn't undermine the strength of the teeth, and then avoiding popcorn, of course, too. So, or the hard kernels, I should say. All right. Well, you've been listening to Dental MD. Thank you very much for listening. I'm Dr. Jessica Sapoff. If you have any questions or you'd like to contact us for an appointment, please call 425-427-8899 in Issaquah and reach us by email, appointments@naturaldentist.com. This is Dental MD. I'm Dr. Jessica Sapoff. Thank you for listening.
Over the rainbow, way up high, and the dreams that you dream of once in a lullaby.
The views expressed on this program